Good afternoon, everybody. This is Rob Bennett, CEO of EcoDistricts, and I'm pleased to have you all join us for our third webinar of the year in our Institute webinar series, Centering Health in District Scale Development. I'm pleased to be joined today by Dr. Whitney Austin Gray, Senior Vice President of Delos, who's going to introduce us to the WELL community standard that they've recently developed. For those of you who are unfamiliar with our organization, we are a 5-year-old nonprofit based in Portland, Oregon, with an explicit mission to develop and advance district and neighborhood scale equitable and sustainable development. We're pleased to have many partners along the journey of developing the EcoDistricts work, and Delos is one of those partners, and we're going to hear from Whitney, as I mentioned, over the course of the next hour. For those of you who are new to webinars, I'm sure many of you are not, we ask you just to do something quite simple. One is to keep yourself muted at all times. There's obviously a lot of people on the line, and background noise can become an issue. I'll be turning this over to Whitney shortly, and I will go to mute as well. For those of you, we'll have a Q&A at the end of Whitney's presentation. There is the ability to post questions on the webinar. We ask you to use that function. And as we go through the presentation, I will be looking at those questions and pulling them forward for Whitney to answer. So I'll be doing the questioning based on the questions that you guys post online. So if you have any other questions about the webinar or after the webinar, feel free to email us at EcoDistricts and we can answer those questions. So as I mentioned, we're a growing community of urban leaders who are dedicated to advancing district and neighborhood scale equitable and sustainable development. We've been in business for 5 years, as I mentioned, and we're really trying to do a couple things. One, we're trying to advance and build a growing community of practitioners who are collaborating in this space, and I would say that our work with Delos and the work that they're doing with the WELL standard is very much part of this community of practice that's growing and advancing in certain areas around equity and sustainable development. We also work to advance projects through our certification, through our accreditation programs, and what we call our accelerator program, which is where we work with project teams and cities to help build strategies around equitable and sustainable neighborhood development. We're obviously focused at the scale of the neighborhood, recognizing that that's really where our lives play out. That's where a lot of success indicators or lack of success indicators dictate the quality of life and the opportunities afforded people to grow and to thrive in their cities. And we recognize too that there are many scales of interventions to advance sustainability at the building scale, certainly at the regional and the local municipal scale, but also at the neighborhood scale. And that's where we spend our days and our energy advancing this agenda. In order to do this, EcoDistricts created the EcoDistricts protocol in 2016. It was based on 5 years worth of work with a global set of advisors to look at hundreds of rating systems and indices and try to create a simple framework to help project teams who are working at the neighborhood scale to advance equity and sustainability. We created a certification to help give power behind the protocol and an accreditation program to help professionals who are interested in learning more about the advancing of the protocol in projects. And when we got going, we actually worked pretty closely with the International Well Building Institute and Delos staff to help us frame out health and wellness and health and well-being as part of a core set of principles associated with district and neighborhood scales, equity and sustainability. We're really pleased that they went further and created a standard for neighborhood work, because the protocol is really focused on upstream performance and governance around projects. We were really excited when Delos and Well connected to build a more rigorous standard, which we're going to talk about throughout the afternoon, which really complements EcoDistrict Certified in the protocol. I mentioned our growing community of practice. We have now 17 projects across North America that are pursuing EcoDistrict Certified. This represents a range of communities from existing neighborhoods to new brownfield developments where over 450,000 people will live or work in these neighborhoods, representing over 16,000 acres. So it's important for us as urban development professionals to really build a network of practice and make demonstrable commitments to this work. And again, over the next hour, we're going to talk about how we do that in very specific ways using frameworks like the protocol and the WELL community standard. But we're really excited to grow a number of projects and to network and pull together the threads of the people who are leading this project so that they can teach others and we can create a learning network that grows over time. What's very consistent in our work is that there is no shortage of those who are interested in advancing sustainability at this scale, but there is a real lack of knowledge and ways to connect the work so that we can share and scale the efforts. And as we dive into today's webinar, one of the fundamental set of principles for us is designing for health. And we're really pleased to sort of be able to dig into this topic over the next hour. It's part of our overall framework that the protocol puts into practice, in which equity, resilience, and climate action are the key drivers, or what we call imperatives of the work. And then we link all of this into a series of what we call priorities around placemaking, around economic and prosperity, health and well-being, mobility and connectivity, green and living infrastructure, and resource regeneration. And ultimately, the drivers for this work to advance around these principles, around these priorities and imperatives, are the actual formation and development of strategies and monitoring of performance that we need to get out of our neighborhoods and district scale projects. So as we zero in on health and well-being, from an EcoDistricts perspective, we have a set of fairly simple goals and objectives associated with this. Again, the protocol and EcoDistrict Certified is a process and governance framework. The sort of details, the technical details of how to execute on health are found in standards like the WELL community standard that we're going to talk about. But the objectives around active living, health, safety, and food systems become the sort of organizing principles for us at EcoDistricts, and really focusing in on the following objectives around access to recreational facilities and walkability, around health outcomes and life expectancy, connecting affordable health care that's accessible at the community level, and remediating toxicity and toxic environments and air quality. And ultimately connecting it to health and safety, and the recognition that safety is an enormous driver towards the sort of viability of a neighborhood and the ability for people to be active and to having a sort of a thriving lifestyle. And finally, that we connected also to food and the access towards healthy and affordable food at the district neighborhood scale. And that there is the ability to also connect to an urban agricultural strategy. So these are our key objectives around health and wellness and well-being. And we have a series of indicators that we use to help trigger project teams to advance on a health and wellness strategy. But ultimately, sort of the technical sort of execution around health and wellness really needs a sort of a further refinement and further sort of strategy. And this is where we sort of dig into our partnership with Delos, and I turn it over to Dr. Whitney Austin Gray to talk about the WELL standard for communities. Dr. Gray has been an active leader in public health, and she's been leading Delos's insights team focused on conducting industry research and supporting the adoption of healthy building practices for some time. She leads the development of the first set of case studies around the WELL building standard and helped to launch over 100 educational training sessions related to WELL in 25 countries. She's now working with over 15,000 and trained over 15,000 design and health professionals around the WELL standard. She's an adjunct assistant professor at the Georgetown School of Nursing and Health Studies in the Department of Urban and Regional Planning in Georgetown, and she received her PhD from the Johns Hopkins Bloomberg School of Public Health and was one of the first public health professionals to become lead AP. So without further ado, I'd like to hand it over to Whitney and just hang with us as we sort of work the sharing screen activities. Dr. Gray, are you with us? All right, I think I've got you unmuted. Dr. Gray,
oh, great. Hi, everyone. Yes, I can hear you.
Oh, great. Welcome.
Thank you so much. And then I think I'm just holding to get screen access.
All right. Hang tight. All right, I think you've got it.
All right. All right. Yes, let's see here. Make sure. All right, guys, we're in action. Perfect. Well, thank you, everyone, and thank you very much to EcoDistricts for having us join you today. We are just so excited to be part of a bigger conversation with, I think, innovators and leaders, you know, really around the US, around the world, that are taking these ideas around sustainability and health, and to Rob's point, creating a process, a procedure, you know, evaluating, enforcing that these changes are more than things that we say. They are things that we do, and they're things that we value, and we have to create a system to support that. And so WELL really lives inside of that ecosystem and saying, and I think many of you probably on this phone have heard people say, you know, yes, we have the healthiest office building, and look at everything we did, or we have the healthiest neighborhood. And for someone like myself, coming from the field of public health, you know, my next question is, well, how do you prove that? And that's followed by, and what is healthy anyway, as long as we're talking about it, right? And 10 or 15 years ago, and Rob, I remember having some great conversations with you about this, you know, health, when you talked about health in communities, people thought, oh, air quality. It's air quality, that's what health is, right? Other people were just starting to get inside of a conversation around this thing called obesity, something that we've not been able to truly reduce in scale, you know, that's spreading. And we're going to talk about obesity being an epidemic. But obesity was coming on the scene, and most public health researchers were starting to say, hey, the environment plays a really critical role, but what is it in the environment? Do people need to be more active, eat less? Is this a stress issue? Is this a social issue? Is this an accessibility issue? So we had a lot of different people defining health in lots of different ways, and very little enforcement as to what actually a healthy place was. And so I think you have some incredible innovators that want to lead that definition, but then even 5 years from now, you come back and they're gone. And that healthy community does not maintain the same programmings, the robust you know, strategies to actually enforce whether or not it's a healthy community. And so we're very much part of that with WELL. It's saying, okay, it's time to first off move the definition of health beyond just air quality, right? Let's really look at this complexity of what health and well-being is in a community. And secondarily, let's really look at how we evaluate that and how we enforce it and how we change, you know, market transformation. And to do that, it is absolutely critical that we have partners, because our system is not meant to be done in isolation. So we work very closely with US Green Building Council, with the LEED standards. Depending on which part of the world you may be joining us from, we work with a Green Star system in Australia. We work with BREEAM in the UK. So we're not trying to replicate any system. And I think what's really exciting for us with EcoDistricts is that, our hope is that we can offer a way to help to evaluate some of your health initiatives in the broader context of your EcoDistrict initiatives. And so that fits very nicely into the world of defining health, evaluating it, and seeking partners. And I think for all those reasons, we are here today. So when I was asked to give this presentation, I definitely come from the field of public health and am really fascinated in translating health and health data into practice. And in the end of the day, if we do research in health and it sits on the shelf and it doesn't activate change, I don't think we're being effective. And so we deeply need those leaders, innovators in the front lines that are truly trying to design this into your community. And so with that in mind, I really wanted to showcase some of the work we're doing in health, some of the science behind the standard. So this is just not a let's look at a checkbox exercise here, but let's really understand what are we trying to do. I'm very open for any kind of question that comes up, so happy to take those throughout or at the end, however that works best. And so with that, I think we'll dive in. So the International Well Building Institute was founded in order to administer the well building standard. And so Delos, which is where I work, we are the parent organization. We were founded in 2008, and we focus on wellness real estate. And so that's a lot of different products and services and strategies. And that includes residential, healthcare, and of course, community design. So we pioneered the well building standard. And over the years in 2014, we released the well building standard, and it's now administered by the International Well Building Institute. And they are a subsidiary of ours, a wholly owned subsidiary. And this is important for us for a couple different reasons. One is that IWBI focuses on certification. That is day in, day out, everything they do. At Delos, certification is critical for us, but not necessary. And we understand people are on the pathway, right? Where are they in this journey? And so there's other products and services that we also support in the wellness real estate marketplace, and we want to have the agility to explore those. So if we see there needs to be a market transformation in air filtration and ventilation strategy, we can create a certification for it, but we also want to be able at Delos to reach out to partners in Japan that are able to create new technology to meet that requirement faster, more effective, and at a better price point. So that's a really important division for us, is that IWBI focuses on the standard purely. And they also have a give back campaign, and that means that there is a contributions of 51% of net profits will actually go back into the community. So the conversation of, healthy for the wealthy and disparities is something that's very near and dear to many of our hearts. And so part of this certification is recognizing that how do we become accessible to all corners of the marketplace? And for some of those corners, it may be through the Give Back campaign. So that is also set up through the International Well Building Institute. So this is what the standard looks like. I encourage you to download it. It is absolutely free. We're pretty proud of that. So it's exciting to hear. Rob mentioned that I'm at Georgetown, and it's really wonderful to have my other peers and colleagues teaching at different universities to use the well building standard, to train future professionals in it, to train them for accreditation. And so, yes, this is free online as well as a certification guide. And the Well Community Standard is, of course, also free to download online. So what you need to know about the Well Building Standard and the Well Community Standard is that it is the first building certification system and community certification system in the world focused on human health. And secondly, it's performance-based. That is probably that's the core of it all, right? It's performance-based. We're not just saying we're going to do something for your health. You have to prove it. So performance testing means we're going to come on site and do a lot of that testing for you. For many of the leaders in this movement, they're already doing this. Testing for them is validating that they've spent a long time trying to get toxins and VOCs out of their materials. They've spent a long time thinking about air quality and access ducts and, diesel fuel engines and where people are standing. And so when we come on site and test, this just really validates what they've already gone above and beyond to do. And for those that are out there selling that they have a healthy community, but their water quality is not up to standard, their air quality is not up to standard, those are things that will then come out of the testing, right? We'll be able to determine the difference between truly community invested in health that can prove it as compared to sort of one in brand only. So we do come on site and perform testing, and that is an ongoing process. That's something we will ask to do about every 3 years. Of course, I think in the future, we'll have a lot more capability to continuously monitor things such as air, water, and light quality. So maybe that will shift in the future as communities are, living and sharing their data in new ways. So currently the well building standard, we are in over 80 countries represented that are either part of a project registered or are a well accredited professional. And we have 1,668 registered projects. And I do want to highlight that the diversity of location is critical. The well building standard is not easy. I mean, this is not something that you just say that you do. And so the projects that have been those early adopters, I think, particularly when we look at places, throughout South America or through, Eastern Europe or in China, where you have severe issues with air quality. I mean, we've really tried to, we can stand behind that if you are a well building, that you truly do represent a healthy place for people to work, as well as a healthy community for people to live. So I want to talk to you a little bit about the Well Community Standard pilot. And pilot for us means that we are adapting it, that these early projects have a capability of really developing features with us. Once the pilot phase is done, then it's formalized and that is a standard. And so there's a lot less ability for projects to contribute specific features. So like any new typology, when we tested, we want to hear from people. Does this work? Does it not? What are the problems? What do we need to add? And that's what the pilot phase is, which we're currently in. And so the Well Community Standard does aim to impact individuals, of course, not just within the walls of their home and workplace, but throughout the public spaces, the interstitial spaces of the community where they spend their days. It focuses on 10 different categories. That's air, water, nourishment, light, fitness, temperature, sound, materials, mind, and community. So kind of returning to an earlier point I made, this is not just air. We're really looking at mental health, loneliness, exclusivity, universal design, thermal comfort, sound issues, access to healthy food. I mean, what truly is a healthy person, right? And what is a healthy community that supports a healthy person? So what I'd like to do is go through a little bit of the context for each one of these categories and give you a bit of the science behind it. So the first one is air. And some of these I'll kind of go through a little quickly, but of course we can revisit those during our question time. And so our goal with air, of course, is that you breathe easy with optimal air quality. We do that through source elimination, building ventilation, and passive design. So ultimately, we have to get out the materials that are causing these off-gassing issues. Outdoor air is regulated, indoor air is not regulated. So we're trying to control these issues and understand first if we can do source elimination that removes the problem potentially. If not, we need to think about how we're actually filtering and ventilating the building and or the outdoor spaces related. And then also looking at passive design. So if we have a space that's underutilized or overcrowded, carbon dioxide is going to be an issue. So how do we address that? Nitrogen dioxide is a big issue here, a lot about in London. I mean, these are public spaces that are right next to congested, small traffic zones in which people are basically breathing in the fumes. So this has an impact on indoor, outdoor ventilation systems, duct access. So passive design is one of the ways in which we want buildings and communities to basically be monitoring the air quality, but passively be able to fix that without human intervention. So this kind of goes to the continuous monitoring side. So some stats here to kind of set the stage is that 7 million people, or 1 in 8, die because of poor ambient air quality every year. This is a significant number, right? This is an environmental health issue. And according to the World Health Organization, exposure to ambient air pollution can be associated with a host of diseases, which include, of course, lung cancer, which you're familiar with, or respiratory diseases, but I'll also highlight heart disease. So if any of you are runners, you might know that the meteorologists will come on the news and say, you know, today is a high alert day, and they'll be speaking actually around some of the ozone air quality issues in your area, saying don't go for a run because you can tax your system. You can have high exposure to particulate matter, and because particulates are so fine in nature at the level PM 2.5 level, that will actually be able to get into your bloodstream. So people don't realize that air quality also has a lot to do with cardiovascular health. So what's really important here is, you know, what can we do to address air quality? At the community level, we want to look for improving people's ability to have access to healthy air. And that will be limiting combustion sources, reducing vehicle idling time, encouraging shared vehicle, public transportation issues. A great example of this is that kids waiting for the bus, think about their breathing zone. Right, they are right where that bus is exhausting, and of course they are breathing that in, and that can be a very simple change as to where children wait. This is true for adults. Hospitals were having a very big issue because the helicopters were coming into the helicopter helipads on top of a hospital right next to the intake duct, which was going right into the intensive care unit. You know, just changing that in the design can be critical, right? So these are really important things where we think about where are cars parked, where are they idling, what kind of signage can we use to decrease idling, because it's better to turn your car off than idle it. Where are children playing? How close is that, you know, to where these vehicles are parked, and such things like that we want to be considering. So you will only see more and more information on water. It's definitely something that we deal with here in DC. People are very familiar with Flint, Michigan, and the issues with water quality. Largely speaking, in the US, you have water treatment centers that are post-war construction. So when they're designed, first off, they were designed to address certain components of the water, but there's argument that personal care products, pharmaceutical products, cannot be detected in the same way. Secondarily, even when these water treatment plants do their job 100%, what happens when the water leaves the plant? Well, it goes through infrastructure, which is run very differently state by state, and then it goes into your home. Now, you have to ask yourself, can you control that infrastructure? Can you control the lead pipes? Can you control the anti-corrosives that they put in the water to be able to get through those pipes that may also leach in lead to your water supply? And truly the answer is no as a consumer. These are very hard things to be able to control. And with that in mind, we really want to protect the consumer at the source in which they are consuming water. So we're not going to ask communities to, you know, rethink water sanitation system, but we are going to ask them to think about what happens to tap water. Is this a filtration system that they can use? You know, where can we look at more effective ways to bring clean, accessible drinking water? This is incredibly important when we look at lead. So lead exposure, particularly as it's ingested under the age of 10, in certain scenarios can have a 10-fold increased impact on developmental issues for children under 10. So it's like the 10 and 10. And these neurological impacts have a lot to do with learning, for example, learning disorders. So there's been great movement, particularly in Baltimore, with some of the healthy homes coalitions to really decrease lead from homes. You've heard a lot about it in paint and then paint dust, but of course, water is going to be another major source. The second thing I would say is that a lot of us will then go to bottled water and say, oh, this is cleaner. In fact, a lot of people love the taste of clean bottled water. Well, what you're really tasting is chlorine. and they chlorinate it out. That is a taste that they've created, and they are not regulated anywhere near what your groundwater is, which means they might have issues with their water supply and which are not monitored at all. For example, an E. coli is not necessarily monitored in their factories or in their production plants. Because these companies want to stay in business, they do a lot of that monitoring voluntarily. But regardless of that, you actually need the minerals and nutrients from your groundwater supply. For example, fluoride. So we need to get you access to groundwater. We need to have it filtered at the source in which you are drinking from. And so the Well Community Standard is going to look very specifically at that. For those of you interested, you can go to Home Depot and buy a $15 water detection kit, and you can find out real quick if you have problems, and you can download the Well Building Standard and figure out what the actual requirements are for healthy drinking. But this is really critical, and not just to mention the quality of the water, but also the accessibility or your ability to have a higher quantity of water is critically important. So for fatigue and headaches and anxiety, it's really recommended that you have at least 11 cups for women and 16 cups for men, which also include from food sources and other beverages. And people don't link water access and hydration to also issues like childhood obesity. So we're understanding that the complex nature of water and the need for clean, accessible drinking water and how closely it's linked to a mirage of symptoms. And you'll see down here, headache, dry skin, disruptions in physical cognitive performance. So ask yourself, if you're at work right now, listening to this, have I had my 11 cups today? Have I, through food and through other sources, but am I hydrated? Because it can have an impact on all those outcomes. The next category is nourishment. And so this is going to be getting access to healthy foods. So this is critical. Let's talk a little about food. So, food is absolutely something that we reward ourselves with. We do not, as human beings, like to be told what to eat or where to go to eat what. So when it comes to behavior change and a health certification, what we want to do in Well is encourage healthy eating. So we make the healthy choice the easy choice and the unhealthy choice the hard choice. So if you want your soda and you want your processed foods and you want your fast food, have them, right? Have them. We're just not going to make it really cheap, really accessible, and piping out, delicious scents right into your home on a regular basis. We want to be thinking about alternative healthy ways to get people eating. So this means fruit and vegetable access. Just being exposed to actual looking at fruit and vegetables on a regular basis, you will eat more, according to Harvard, and they've done quite a few studies on children gardening and access to fruits and vegetables and people being more interested in eating them once they've grown them, of course. We want to reduce processed foods, things like trans fats. We want them out. There is no evidence to support that the positive nutritional quality of trans fat, rather the positive benefit is shelf life largely, and that sort of crunchy taste that you can get from a product that's been on the shelf for 3 months. So we're really understanding that from a metabolic perspective, trans fats are really challenging for us, and so we want those out. We look at sugar. There's 52 different names of sugar out there, and believe me, they'll try everything to get into your salad dressings and your fruit juices and your sodas. And so, if you want sugar, go for it, have it, but know what's in there, know when you have it. And we don't want to be, fooling consumers into putting in absolutely everything out there. So we want to be looking at healthy alternatives from processed foods. We want to make sure there's nutritional information and education. So this is really important that there's transparency on food that's offered. There's stats that look at the increase of allergies in the last 3 to 5 years going up 50%. Now, is that because there's an increased detection? Is this because there's issues in our food supply? I mean, it's complex. But suffice to say, there are more people dealing with allergies today than even 10 years ago or 50 years ago. And so making sure that you are labeling things, for example, with gluten products or with tree nuts, this is really critical. And I think a lot about kids for this one. The kid in the school that just doesn't want to make a big deal out of it, but they have a pretty severe allergy. We want to give them the choice, and unless the food is labeled and they feel empowered to ask questions, issues can occur. So we really want transparency for that. Food advertising and promotion. If people are familiar with nudge, sort of nudge architecture and this choice architecture and this concept of, if you're exposed to a lot of advertisements, you're going to want to eat what's on those advertisements. So 1.6 billion is spent every year targeting children and teenagers for breakfast cereals and related foods, reds and yellows and colors that engage satiation and make you want this food and associate fun cartoons with it. So there's a lot to this, and we really are conscious of just how much food advertising there is. So we want to be thinking about being more positive about our promoting healthy food within our well communities. We also look at food security. So again, accessibility to food, the safety of the food, making sure we don't cross contamination. And we want to look at supporting breastfeeding. So of course, this has a lot to do with the development of the immune function of the child and access to breastfeeding. So we also support that through well community. So a couple of stats on obesity, and these are gloomy for us in public health because it is what we consider a pandemic. Obesity is no longer an epidemic. It has literally gone global and is contagious in nature. As we look over the statistics in the last 50 years, we see substantial growth. In 1970, 1980, if we looked at major survey sets through the BRFSS, we would determine that most states at maximum had 10% of people obese. Those states, we've had to change the metrics because now we're at upwards of 30% of people being determined obese. So this is over the years we've seen this development, and it continues to grow, and we have not fixed it. We're seeing some movement with childhood obesity, but still a long ways to go. And one of the leading ways to address obesity and to prevent it actually is through what we call active commuting. This means you have to move to get to where you need to go. So building into your day that you can't park right next to the building or that you need to move throughout the day to get certain services, this all contributes to active commuting. You have to move to get to where you need to go. And these are the kind of strategies you want to look at. Make the healthy choice the easy choice, the hard choice, right? The unhealthy choice, the hard choice. And these are things we can start to do to address obesity. Those that are obese, this is a significant issue, particularly those younger, type 2 diabetes, cardiovascular risk, but this also is the employee that's very, for an organization's perspective, they're going to go to the emergency department more. You'll be spending on average, $8,000 a year on them as compared to a worker who's not obese, and these stats are only rising. So the impact on overall health outcomes, ability to maintain employment, and also not be out of work with high absenteeism rates. So a vested interest in looking at this. And I have to note here that too often the issue of obesity is looking at someone and saying, you're fat, your fault. We call this victim blaming in public health. And this sort of attitude leads to people saying, well, it's not my problem. But it is your problem. It's all of our problems, right? This has to do with community health issues. And so really encouraging us to look at a community level around issues with weight, for example, here with obesity and all different types of eating issues that are explored here, but that it really requires a community effort. And this is, like I said, not going anywhere. And so we're hoping to make a dent in that by thinking about healthy design. So we also focus in light. And so we're going to look here at illumination levels for roads and walkways, limiting light pollution and light trespass, and glare and discomfort avoidance. So digging into this a little bit, we are focused largely on this concept of circadian light and circadian rhythms. So this has to do with your internal clock. It's not just a sleeping rhythm, if you will. It has a lot to do with organ function issues. We're now finding that shift work, so that's night shift work is considered carcinogenic, linking to neuroinflammation, breast cancer, sleep disorders, and metabolic dysfunctions. We don't entirely understand this. When we disrupt sleep patterns for prolonged periods of time, this absolutely has an impact on our health. And so thinking about the cities that are always lit up, overlit up, the shopping malls, right? The convenience stores, this sort of light pollution that's part of, many city dwellings, is rethinking about where light plays a role positively and then where light can potentially have a negative impact if misused. We think that proper lighting at night can have many benefits, including even cultural benefits. So you can better detect obstacles, injury avoidance, perceived safety, crime reduction, increased physical activity, social cohesion, community pride. We're doing some research right now on healthy aging. And when I look at this, I think, are you inspiring people to walk at night? As someone aging or as a woman, I mean, these populations are like, this isn't safe. And even if I did walk, there'd be too many obstacles. And what happens is you take away the leading way in which we can prevent obesity. So these are very intertwined concepts, right? When we're trying to activate a community in a space, light plays a critical role. If you're interested in this, there's a really interesting body of research called Crime Prevention Through Environmental Design. For those of you that are also living with me in DC here, you can use DC Metro as one of the best examples of CEPTED. And they also report having one of the lowest, if not lowest, crime rates in a metro system anywhere in the world, which is pretty phenomenal. This is including the actual metro system and not the perimeter spaces of those stations. And a lot of it has to do with thinking about light, thinking about design, thinking about where predatory issues can occur. And so light plays such a really critical role in safety as well. For fitness, we want to get you up and moving is the most important thing. And so we want to think about cycle infrastructure, mixed land use, connectivity, walkability, active transformation, and environmental design to reduce risk of transportation-related injuries. So I'd encourage you to not use the word accidents. So accidents imply it's chance, but we would argue this is a design issue. So the majority of people that die from a motor vehicle crash or a motor vehicle incident are going to be pedestrians. And thinking about neighborhood design, there's some very simple models. Most people are not aware, but if they come to a stop sign and you have a four-way stop, that can be one of the most dangerous designs when it comes to pedestrian safety, because if they walk ahead of the car stopping, if there is the wrong time of day or a light issue, that's a very severe strike, typically a head-on strike. Whereas you'll see other models even bring in circular, so traffic circles, which may not be everyone's favorite, and there's some designs that are better than others, but the idea is you're not able to strike the pedestrian in the same way because they're moving sort of with traffic and traffic's moving slower and there's not the same T-bone episodes. So these are small things, but they add up and they reduce the risk of people having a potential, incident where they could be quickly injured or potentially disabled from a motor vehicle crash. So we've discussed this before, but obesity, diabetes, critical. We want you up and moving. And so if the place is unsafe, if there's nowhere to go, if there's nowhere to stand, if there's nothing to do, you don't move. Your ancestors never went to the gym. This idea of having intermittent activity throughout the day and a reason to go somewhere is not an inconvenience. That actually is how you get physical activity throughout your day. I like to recommend that every 60 minutes you have a micro movement and every 90 minutes a macro movement. So 60, that means a micro movement is standing up. That's enough to change your metabolic rate, your enzyme function, your brain activity, oxygenating your blood. And then every 90 minutes, a macro movement is going up and down the stairs once. And that's enough many times to just continue to keep the metabolic rate up. We're talking about sitting being the new smoking. So a lot of cumulative risk. So sitting in a place, no matter how convenient it is for prolonged periods of time, increases your risk for premature mortality. So we want to get you active and we want to think about ways in which design can help to do that. Which also, I would include fitness and movement should be social. We're very social creatures and a little bit of peer pressure goes a long way. So thinking about a walkway not for one but for two, a staircase for two, enabling people to go and move together throughout your community. The mind section is one I find absolutely fascinating. I would argue that we've moved from an era of infectious disease to chronic disease, and now we are in the era of mental disease. So this means that you're at increased risk of dying from, for example, suicides or comorbidity with mental health issues than ever before. These are very scary stats. I probably don't need to share with people, but those coming back from service and veterans, we've lost more to suicide than we did in combat. An extreme scenario, but still a very pertinent one. Those that report that they are isolated over the age of 55, research coming out of University of California, San Francisco, demonstrating that you're at increased risk for premature death. We are not meant to be lonely. We're not meant to deal with this in an isolated factor. So where we live, how we connect with people, communities that we build, and monitoring, understanding mental, not just mental health or mental disease, but I would say mental well-being is critical. And design plays a really big role. If you're able to isolate yourself in your office or isolate yourself in your house, no one's there to monitor you. No one's there to have that social function, that connectivity, right? And there's also extreme life events that people are going through, substance abuse, addiction services, lack of access to healthcare. It just compounds this even further. And we are absolutely paying a lot for mental health issues. And so preventatively looking at how we can create resilient communities up front is a focus for WELL, and I think an ongoing exploration. We are actively involved in research on this. We actually just completed a research study on burnout. And stimuli management. And we're watching these new trends of people reporting that they're in their 20s and they're actively unemployed, burned out. Their job will be waiting for them. They've given it everything in their 20s, and they'll return when they're ready, and they take a year off. 16% of workplaces are actually even offering sabbaticals. 4% are paying for them. So these trends are kind of poking up, and we can spend some more time talking about that, but design is critical for mental well-being, and we want to actively look at how community can be able to achieve a more resiliency to support mental well-being. If you can't tell, it's an issue that I find particularly fascinating, so definitely happy to answer any questions on that. 1 in 2 people will deal with a mental health issue in their lifetime. About 1 in 5 are dealing with an episode right now. That means you or your neighbor is dealing with some sort of mental health issue. We all have mental health. We can't live without it. Our brain's attached to our bodies. So instead of stigmatizing it or dealing with it once it becomes a problem, how do we proactively look at this through design? And so we look at mental health services, treatment, prevention, understanding there's multiple different aspects of community design that can support access to care and availability of services and prevention. So for temperature, this is an area that we're going to be looking at issues of heat island effect, extreme temperatures, sun exposures, UV. Of course, the UK experienced a heat wave. Europe did. We see deaths as a result of this. How can we think preventatively about making sure that we're addressing that? And we do a lot of work with urban heat islands. So energy consumption, elevated emissions of air pollutants, decreased water supply issues. So I know I'm speaking to many experts on the phone that have a history of tracking and evaluating energy performance. And so I think this is a particular area where we see this direct linkage to human health, and thinking about the energy that's being spent to over air-conditioned areas, and how we can innovatively understand how people are using spaces with the ultimate goal not to maybe 100% make people comfortable, but is to ultimately make people healthy. And we can talk a long time about air conditioning if people want to, but it's kind of this issue of really monitoring our energy efficiency with the end goal of a healthy community. And we do believe that temperature is a part of that. So sound pollution's a big deal, a very big deal. So we want to plan for acoustical issues. We have some techniques to do so. If you are under the age of 15 and you grow up next to a highway, we're really looking at some of these pain receptors, catecholamines being affected when you have this constant ambient noise. And we don't entirely understand understand the impacts that that's having. But if you spend your day constantly exposed to ambient sound, particularly over 85 decibels, this has an impact, right? And we're looking at increased hearing issues occurring. About 1 in 5 teenagers now have potential hearing issues that we're tracking. So this idea of how do we create environments where we can dampen the noise, absorb, cover the noise, create alternatives to that is important. And of course, we look at materials. This is our source control issue. So we want to make sure to reduce exposures. Think of low VOC issues, reduce the chemicals within the products that we use. And there's been a lot of work on this, so we're not going to recreate the wheel. We'll turn to our partners and experts across the field with LEAD, with Living Building Challenge, and with others, really trying to understand how to reduce toxins. And our final section is community. So this will be supporting an integrated, equitable community through health impact assessments, through health promotion programming, through the crime prevention, through environmental design, as I mentioned. Policies and planning for community disaster and emergency preparedness. The term resiliency has a long history within health that has to do with basically an organism being able to withstand the demands, right, the stressors of the environment, and being resilient, being able to cope and address that. And so when we talk about resiliency and community disaster and emergency preparedness and issues around climate change, really thinking about how do we create resiliency within people in these communities is also something we focus on. Disparities, and of course this issue that your zip code's a greater predictor of how long you'll live than your genetic code. A lot of research coming out of this. After you control for some pretty critical variables of income, we still see that where you live matters. And there can be upwards of a 25-year disparity in life expectancy, 1 mile distance in a city. So this really brings into focus that environment is so critical to longevity and to health. Okay, so kind of pausing and moving on here. So for those interested in learning more about the WELL building standard, those are the 10 categories. That's a little bit of a snapshot of the background and science behind the different categories we focus on. And of course, we're always evolving. If there's something we didn't cover, if there's something you're passionate about, those are areas where we want to hear from you. We want to continue to evolve the standard. If you're interested in being a WELL community, I wanted to give you a little bit of context for what those projects look like. So of course you register for your project, which locks you into the scorecard and gives you access to a WELL coach. This will be a person will walk you through the whole process. And eventually you will submit documents. We're pretty heavy on performance metrics as compared to documentation. So we try to reduce some of that, the onus, and put it on the performance verifiers. And then we will also come on site to do testing when your project is ready. We understand these projects can take multiple years as well. So we understand that, and there is a time component to it. This is the website if you want to find a little bit more out about WELL Community and wellcertified.com. And I wanted to highlight some of the parameters for buildings pursuing this. And so we do have square footage parameters. We do look to who is owning, this space or developing it, or if it's government led. And so that's all going to be within our requirements for WELL Community, and that's where you'll be able to find all of those issues. For a lot of our pilot projects, these are direct emails, to our team to say, does my project meet this requirement? Tell me more about this. Let me learn more. And they'll reach out to you and you can have more of a conversation, because I wouldn't say that it's as easy or as simple, and there's lots of different variations of what constitutes a community out there, as many of you know. So I would encourage you to look up more information and definitely inquire. So kind of wrapping up here, I just had a couple of end slides to show the business case. This has to do with who's asking for wellness communities. What are the trends globally? And how much are people putting towards this? What is it like to live in a healthy community? Why is this something that people, value? In many ways, I'd argue this should just be an amenity for all. But initially, we are seeing some drivers in the market. There's estimates here that the largest market sizes for wellness lifestyle real estate are expected in the US, China, Australia, and the United Kingdom. And we know there's premiums. So we see, upwards of 30+ percentage premium that people are willing to pay to be in a community that promotes wellness, to be with like-minded people that promote wellness, to have access to healthy food and movement and good light and so on. So since we launched this in 2017, 10 projects have registered, and I think we're up a couple since then. So Water Street's our big one. That's a $3 billion investment, 50+ acre mixed use development. We've got a private project in London and Dublin. We also, here's a picture of Kearney Point Shiplin in New Jersey. That's 130 acres, a much smaller campus. Isla de Ville is a 7-acre mixed use project in France, and we have several projects ongoing in China. So just to kind of wrap up here, ultimately, as I started this presentation, I put forward this notion that, if you live in a healthy community, it needs to be more than just saying that it's healthy. And we need to be able to demonstrate that and to prove that. And to do so, we do need to have robust certification systems that work in partnership and in tandem with larger processes and systems. And so that's really where WELL sees that we can contribute to sort of the vision and mission and ongoing work of EcoDistricts. And we can provide some of those ability to test performance and drivers inside of your programs. And as I mentioned, this is all free to download online. And so there's a lot of resources that we'd like to share with you. And we definitely welcome an opportunity to have more conversations with you and to learn about your projects. So with that, I will close out. Thank you, everyone. And of course, you don't have to be part of a WELL community program to be part of our family. So definitely look us up and join the community, and we look forward to having some ongoing dialogue here, and I'll turn it back over to Rob for some questions.
Great, thanks. Thanks, Dr. Gray. A great presentation. Obviously, she was covering a tremendous amount of science and research and in the medical field as it relates to the impacts and the external impacts, the internal impacts that health have in community development. Some of your questions are quite interesting. I wanted to take one off the table pretty quickly. One was around the integration of the EcoDistricts protocol and certification and WELL communities. For those of you who are not, familiar in the details of either, our protocol and certification process is really designed for the teams that are pursuing to really develop their strategies and the performance indicators in the 9 imperatives and the 9 imperatives and priority areas. So as it relates to health, we have a series of what we call illustrative indicators that are guideposts ultimately for those who are wanting to pursue EcoDistrict certified. WELL is a really powerful and much more sort of detailed and sort of evidence-based rating system. So we see it as a very good fit for those pursuing EcoDistrict certified. We take a broad view, of course, around sort of comprehensive community and urban redevelopment. All of our projects have to have a very sort of demonstrable roadmap and set of strategies across our imperatives and priorities, in which health is one. And then WELL becomes a very powerful tool to advance a very specific set of activities that are backed up by both the science and the monitoring required. So we view it as a very complementary system. We have one project in our cohort that has agreed and made commitments to pursue both EcoDistrict certified and WELL, and that's the Metro Health redevelopment campus in Cleveland, which is $1 billion redevelopment of their main hospital and research facility, and working with the community surrounding that neighborhood to advance the goals and objectives of both systems. So that was one question. Another question for Dr. Gray was it really about the intersection of the public health community and the built environment community, the A&E industry, and what opportunities for partnership are you seeing, you can highlight where these often very different set of practitioners are coming together to develop strategies. You mentioned in the final area around community and health impact as one. Of course, health impact really is being driven by the public health sector, but can you give some examples where these worlds are colliding in positive ways, and sort of in any specific sort of stories you can tell on that? And we have 1 minute, we know, so this will be the last question.
Okay, so I can spend another hour on that one. So I come from the field of public health, and let me just simply say that I think in large part the movement is being made by design professionals right now. I say that critically and with love to my public health colleagues, but design is forcing a conversation on the table. Development's forcing this conversation, and designers are willing to step up and step in to how do we design for health? How do we develop health? How do we bring in health experts into the design process? And so I get very excited about that as compared to the public health community. I think can kind of come across like, here's a lot of things we should do, but then designers are like, yeah, but how do I do it? Right? Or, we start talking about these metrics and evaluation, and maybe utilities is like, great, yeah, that's important, but how do I do it? And so I do think that I really commend the design, real estate sustainability sector for leading this in many, many ways. I will very specifically say that as they are leading this, well is meant to be a tool in their toolbox. So we really don't consult directly with clients as much. I mean, we'll definitely help wherever we can, but ultimately we prefer the design team have well in their toolbox, and they come and they know you. They know the project. They've been working with you. They get it, and they use this as a strategy, and they give us a call when there's an issue. At Metro Health, there's a large charrette. We were there to help support the design leaders to incorporate well into the program. So that's the space that we really want to be to support this community. And that all being said, I couldn't encourage enough, and I am faculty for this purpose to really try to educate more health professionals in the role of design. So if there's those listening on the call that would like to learn more or get engaged or have ideas how we can bring these two industries together, it's definitely something that I feel very strongly about. So would welcome the opportunity to have that discussion too.
Great, thanks, Whitney, and thanks to all of you who are participating. We know there's more questions, and we weren't able to get to all of them. I will review those questions, and we will put a bit of a Q&A together that we will attach with this presentation. I'll work with Dr. Gray on that, and as a result, we will get this out, both the recording and the slide deck, for all of you to be able to dive in more detail. Obviously, there's so much we can do on an hour webinar, but the intent was really to introduce you all to the WELL community and the partnership that EcoDistricts has with Delos and the International Well Building Institute. Thanks again to Dr. Gray. Thank you all for participating. If you'd like to learn more about EcoDistricts, go to our website. Our next webinar scheduled for July will focus in on financing EcoDistrict projects. We have a foundation course schedule. Our next foundation course is in partnership with the Congress of New Urbanism and their conference coming up in Louisville. If you're interested in becoming an accredited professional, if you're interested in learning more about EcoDistrict Certified, do contact us at your leisure. Again, thanks again, and we'll talk to you soon.
Thanks, everyone. Be well. Take care.
Bye-bye.